Hi, my name is Professor Harry Witchell, and I'm discipline leader in physiology at Brighton and Sussex Medical School. And this video is a thought starter for starting biomedical engineering students. And we're going to be talking specifically about pacemakers and ICDs, that is implantable cardioverter defibrillators. So a pacemaker is an implantable device that electrically stimulates the heart. It stimulates the heart with a single trigger, a single electrical stimulus to trigger each heartbeat. That is, it's stimulating it beat, 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 one beat every time. A pacemaker is thought of as basically having two parts. One is called the can or the pulse generator, which is here, and this is a rather old one. It's larger. They make them much smaller now. But the pulse generator contains electronics, telemetry, and the battery. In addition to the can, you also have the electrode, which extends from the can to the part of the heart that's going to be stimulated, which could be the atrium, a ventricle, or both. So pacemakers are positioned for implantation such that the can is placed under the skin unobtrusively. So the can is hermetically sealed, it's titanium or titanium alloy casing, and it's often placed either on the side of the chest under the left shoulder, kind of in the underarm region, or just under the collarbone. So here's an example of a chest x-ray showing where the pacemaker is. And just so for example, here's the spine and in here is the heart where you would see this. And of course, remember that in x-rays, everything is backwards. So this is the left side here and this is the right side over here. So while the pacemaker is being put in place, the electrode has to be carefully threaded, usually via a vein such as the subclavian vein, to the heart, where it will actually be set up so that the electrode tip is touching the heart. It's typical for it to be touching inside the right ventricle, or it may be set up in the left ventricle. It really depends on the specific pacemaker and the needs of the patient. How In addition to the can, you'll see that here's the electrode. If you just follow it, the electrode is just slightly below this yellow line. You can see it in white. And the placement of the atrial electrode is there, whereas the placement of a ventricular electrode in the right ventricle. So that was the right atrium, and here's the right ventricle placement there. So here's my first thought question. I'd like you to spend some time either conversing with your friends or just thinking about it on your own. Now, we know that an implantable cardiac device has to work reliably for years inside of a person, which is basically a moving, wet, and electrically active body. So what do you think are the biggest challenges for powering this device, the pacemaker, for protecting it, and for keeping it safe? Why don't you spend a few seconds just thinking through what you have to say about that, and then you turn off the tape and then turn it back on again. Right, I'm glad you've gotten some answers to that. Let's talk about some ICDs or implantable cardioverter defibrillators. So ICDs are similar to pacemakers in appearance. So they have a can and an electrode, or electrodes, multiple electrodes, and sometimes the same device can be both a pacemaker and an ICD. So the same device with just slightly different electronics in it can do both. So these dual-use devices are sometimes called dual-function ICDs or ICD pacemakers or implantable cardioverter defibrillator with pacing capability. So that said, an ICD, that is something that acts as a defibrillator, functions in a completely different way from a pacemaker. A defibrillator resets or resynchronizes the heart. So a defibrillator will fire only when needed, perhaps once per year, instead of, in the case of the pacemaker, we're talking about once per beat, basically every second. A defibrillator might only fire once per year, or possibly even never. Defibrillators are a device to deal with risk. Now, when a defibrillator does fire, it delivers one very big electrical shock instead of a rhythm of small electrical pulses. So with a pacemaker, most people who have pacemakers implanted, they're not really going to feel every single electrical stimulus. but you can be sure that when a patient has a defibrillator that fires, they will notice it. It's literally shocking. For many of them, it's quite frightening. Now, what is the clinical relevance? Well, pacemakers prevent syncope. Remember, syncope is the loss of consciousness, so it's fainting or a blackout, but that's due to cardiovascular issues, usually due to the fact that sufficient blood isn't going to the heart. And that's quite different from blackouts or fainting that are due to, say, a seizure. Oh, pacemakers are essential for patients with bradycardia or for a risk that a heart might just stop firing. And an example of this might be third-degree heart block. We'll talk about that on a different day. This is very different from ICDs or defibrillators. Defibrillators are devices to deal with known risks that are meant to prevent sudden cardiac death. That is when the heart becomes suddenly very disorganized electrically, such that it can no longer pump. And instead of having minimal or too little activity, often during sudden cardiac death, patients have too much electrical activity, but it's disorganized. So ICDs or defibrillation is essential for patients with ventricular tachyarrhythmias, that is fast heart rates, very fast heart rates, or risks of very fast heart rates, for example, above 200 beats per minute. And it's also important for patients with severe heart failure. And this would be called cardiac resynchronization therapy devices. So again, let's compare pacemakers to ICDs, or the defibrillation function. A pacemaker is a device, an implanted device that corrects slow or irregular rhythms. It fires about once per second in order to trigger each and every heartbeat. And each of the electrical stimuli that comes from the pacemaker is small. Compare that to the defibrillation function, the ICD. That's a device that detects dangerous, especially fast arrhythmias, and then delivers shocks to restore the normal rhythm. Now, the defibrillator fires only when needed, when the heart's electrical activity is explicitly dangerous. That means that it fires very rarely, at most, say, once per week, or maybe only once per year, or maybe never, depending on the patient. When it does fire, it delivers one big shock. And this shock is meant to reset the heart's electrical activity, allowing the heart to resynchronize itself so that the electrical activity is no longer disorganized. So here's thought question number 2. A pacemaker or a defibrillator must detect the heart's own electrical activity before acting. That's especially true for a defibrillator. But my question to you is, what could happen if the device misinterprets the signals in the heart that it's supposedly detecting? And how might engineers design the either pacemaker or the defibrillator to avoid these problems? Take a moment to think about that. Right. Well, I'm glad you've thought that through. I just really want to thank for attributions. All of the images that you've seen here have come from Wikimedia Commons, and here are the people I want to attribute to those to. I thank you very much, and thanks for watching.